So general internists. So what do they do typically? Like I mentioned earlier, they work on acute care, they work on chronic disease care, and also adult wellness and checkups. So a lot of the work that you'll be doing in the hospital is going to be the inpatient setting. So you'll be working with patients that deal with MI, strokes, respiratory failure, renal failure, and also you'll be doing chronic care, nursing homes, outpatient settings, hospice, and most of the diseases that are associated with chronic care: diabetes, hyperlipidemia, congestive heart failure, coronary artery disease, uh, coronary, and also COPD as well. So these are some of the main patients you'll be kind of getting familiarized. And then, of course, you'll be doing wellness checkups as well, screenings and so forth. Screening is really important also in the United States. So what will make a good internist? So the best way you can be a good internist is you gotta integrate things. If you can integrate things, combine the pathology with the management, with the labs, with the surgery, put it all together, and see the patient as an overall patient, or understand the patient as an overall, then you're going to be a good doctor. Okay. If you can put things together rather than just looking at the labs and being like, oh, this patient has this, put everything together. And that's going to take time. Make long-term doctor-patient relationships. This is one of the most important things. And we can give a whole different lecture on this, but this involves ethics. Understand about empathy. Empathy is one of the key things to forming a long-term doctor-patient relationship. Also, act as a head coach, coordinator of care. Take leadership opportunities in residency and also as attending, and understand diseases. This is some of the hours that you'll be working as an outpatient, inpatient. Inpatient usually shift is 10 to 12 hour shifts. Outpatient is at 10 hours in the weekdays.